Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
Poor communication. That's true. Poor communication. That's one of the biggest reasons why a lot of these people jump from one agency to the other, right? Whether your agency does not pick up the call on time, you're slow to respond, there's faxing problems, no communications after the referral was sent. It's funny how for you home health agency people, when you guys get a referral, right? How fast do you return the call to let them know that, guess what? The patient can be accepted. I've seen agencies call later in the day, towards the end of the day, and tell them that, hey, we can't accept this patient. The moment you get one of those faxes, the moment you get a referral, you should be able to answer within 15 minutes. Heck, here's the truth. When you receive a fax, you should give them a call and say, hey, just to let you know, we're running the patient through right now to see if the patient's going to be approved. I just want to let you know that we actually received the referral. Thank you so, so much. We're going through this right now. Give me about 15, 20 minutes. I'm going to give you a call back. How amazing is that? How hard is to make that 15-second phone call to that person that you received that? This is money for your company. You're getting a referral. So why aren't you working your butt off, making sure that you can take care of the patient? Does not pick up any phone calls. This happens a lot on the weekends, right? Yes, I understand. Your office is open Monday to Friday. Technically, you're open 24 hours, but nobody's in the office on the weekends. So you have an on-call, somebody who has a cell phone. But here's the thing, guys. Sometimes that person on the weekend is off, and they really can't answer the phone. So here's the thing. You should have a call center that's going to be able to answer the calls at least for you right away. Somebody that's paid. Heck, we have our own call center that we help a lot of agencies be able to answer their phone calls during off hours, during nighttime. We have nurses available just in case, if an agency prefers to have a nurse answer any questions of any patients. We charge what? A minimum of $79 a month to answer your phone calls and just charge you per minute? If not us, find a company that's going to be able to do that for you. Why? Here's the thing, guys. Even when your doors are open, there should be a rule in your company. And these are rules of great organizations. That is, a phone should never ring more than 3 times and should be answered within that time frame. Have you ever called somebody and the phone just kept ringing and then you just get annoyed? Let me ask that question. Has it ever happened to you? You're trying to speak to somebody, you tried to call someone, and all of a sudden nobody's picking up the call, right? Nobody's just picking up the call, and how does that feel? It upsets you sometimes. People value time, and if you make people waste time, they're going to hate you for it. So make sure either somebody's in charge of answering the phone calls. Number 1. Number 2, if you can't do that, hire a company that can and really isolate the calls and manage those and transfer it as needed. Slow to response. Respond fast enough. If you get a fax, return a fax like you received it. But the truth is, don't send a confirmation fax if you received it. Give them a quick call. Fax comes in, dial that number, beep, 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 whatever tone you want. Give them a call and say, hey, I received the referral. Thank you so much. We're checking on it now. Give me 15 to 20 minutes. I'll then let you know what's going on. Do you want me to text it to you? Do you want me to email you? Or do you prefer me to call? Reason why I ask that, because maybe that's a way they want to be able to get or communicate with. But guess what? I may get their email. I may now have their cell phone. Right? Every which way you have to do this, you need to be able to be working hard. Your team in the office should be part of the whole sales and marketing team anyways. Faxing problems. Listen, by now, if you still have one of those dial-up fax, please stop. There's this thing called an e-fax nowadays. They even have apps right there alone. And the truth is this. You should have a separate fax number for referrals. Let me say it again. You should have a separate number, a separate fax number just for referrals. Because you don't want referrals to get bundled in with other things being faxed to your office. If you don't have this, why? Because you want to be cheap about it. The truth is this, you should. And you should definitely have an e-fax. By now, you should not have one of those fax machines that's, printing out nonstop unnecessary stuff. You should have an e-fax. Why? Because a lot of things we need now are paperless, right? So if you're getting patient information, you should be able to save it into a PDF and put it in a patient's file. At the very same time as have a separate fax number for any communication for referrals. This is something that you guys should make sure you actually have. Now, talking about no communication after referrals. We hear this a lot, right? People that refer patients, they want to know what's going on with their patients. So what we do is when we admit a patient from a nursing home, once the patient gets admitted, we will shoot over an email
Brought to you by our partners at HomeCareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomeCareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomeCareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.